Hello everyone, welcome back to my YouTube channel. So today we are talking about the shoulder injury rehabilitation process. So as you guys all know, dealing with the shoulder injury, whether it is rotator cuff tear, dislocation or any strain, recovery can feel frustrating and it may be painful. But with the right approach, you can regain full strength of mobility. And in this video I'll guide you through effective strategies to recover safely and confidently. So first we have to take a representative diagram in the form of x-ray, that what how shoulder injury or how shoulder looks like. So I can show you some pics of the x-ray in AP view, lateral view. So these are the, yeah, this is your shoulder joint. So let us study about first a little anatomy through a diagram of the shoulder. Okay, so this is the diagram and here are some shoulder injuries. So the first is rotator cuff tear, the shoulder impingement is there, dislocations and tendinitis. So when we are talking about the recovery period, we have to know the recovery period should be covered under some phases. So the first phase is acute phase. So acute phase is the first few days post injury के बाद जो आपके कुछ दिन होंगे, first few days comes under the acute phase. So the important thing in this phase is you have to rest and immobilization is there. Then ice application duration is 15 to 20 minutes for every 2 to 3 hours. So it is basically for reducing the swelling and inflammation. Then if doctor prescribes some medication, then anti-inflammatory medications are there. So in this acute recovery phase, you have to note that lifting or sudden shoulder movement is totally contraindicated, so avoid this. Then comes to gentle mobility and stretching. So gentle mobility and stretching, once the pain is subsides, begin with gentle range of motion exercises, and these exercises are like pendulum exercises, wall crawls exercises, shoulder blade squeezes, and these gentle exercises and stretching promotes the circulation and prevent the stiffness of the shoulder joint. Now comes to the another phase, which is strengthening phase. So after this, gradually add the strengthening exercises. So these exercises are like external rotations with resist band, scapular stability workouts, and push-ups on the knees. So the push-up on the knees is basically if when it is approved, and do this under the physiotherapy guidance to avoid re-injury and reoccurrence of any other deformity. So after this, return to activity phase is there. So most people return to full activity in 6 to 12 weeks. It is totally depend upon the severity of the injury. So basically you have to be consistent and focus on the rehabilitation procedure. So in this procedure, always warm up, then maintain shoulder posture and avoid overuse of the shoulder joint and the areas related to your shoulder joint. Then the last but not the least, recovery always takes time, but yes, it is possible. So stay patient, follow structural plan and work with professionals when needed. So yeah, if you like my video, subscribe my YouTube channel, do comment, and please press the bell icon to get more update related to the educational videos. So thank you.